when we had teams in Ukraine at the beginning of the war, and we were working with a nonprofit doing medical response and rescue missions with the orphan children in Ukraine. And we thought having our vans with big crosses and stickers that say, "Don't shoot children on board," things like that, would actually keep us safer, and it didn't. We found out that we were drawing fire because they were targeting medical people. And that's not the first time that's happened. And now think about a grid down scenario where you've got mobs of people that are in zombie mode. They need something, they're hungry, they're thirsty, their children are sick, and they see something that has a symbol of what they want, you immediately become a target.
Everything you know about building a medical kit for disaster or even the apocalypse is wrong. In today's video, we are going to completely change the way you look at building an SHTF medical kit. And we brought on somebody with decades worth of experience working in real disaster zones who's accustomed to having bullets flying overhead. Without further ado, let's go talk to the medic, Aaron Asay of Jaseaid Medical. So Aaron, tell us a little bit about yourself and what you do.
As you mentioned, I'm a physician assistant. My background is in disaster medicine. Before that, I was a firefighter, paramedic, and I'm also in the military. I do CBRNE disaster response, which CBRNE stands for chemical, biological, radiological, nuclear, and explosive. So mostly terrorism-related disaster. I'm on a team that does rescue and medical control after events like that. So
you're the guys who are going to come and dig people out if someone drops a nuke somewhere.
Basically, yeah.
Right. And you climb mountains, and you run sled dogs, and.
Yeah, climbing the mountains and running sled dogs is for the PTSD. So the rest of it is the work, and that's to keep the brain functioning normal. And
tell us a little bit about this kit. The first thing that strikes me is the color and the form. Is there a rationale for that?
I wanted something that would be somewhat discreet, that doesn't scream, "Hey, this is a medical kit."
And why is that?
Because that makes you a target, actually. When we had teams in Ukraine at the beginning of the war, and we were working with a nonprofit doing medical response and rescue missions with the orphan children in Ukraine. And we thought having our vans with big crosses, red crosses, and stickers that say, "Don't shoot children on board," things like that, would actually keep us safer, and it didn't. We found out that we were drawing fire because they were targeting medical people.
Were they targeting medical people because they were helping out the soldiers, or were they targeting them because they thought that they were soldiers hiding as medical people?
No, they were targeting medical people, and we know that. In fact, there's accusations of war crimes because of that, because they were specifically targeting medical people. And that's not the first time that's happened. That happens all the time. And now think about a grid down scenario where you've got mobs of people that are in zombie mode. They need something, they're hungry, they're thirsty, their children are sick, and they see something that has a symbol of what they want, you immediately become a target. So I wanted to avoid that. So anything on this that looks medical, which the only thing we have is that little pill plus next to the Jace.
This can come off,
but that can come off.
Yeah, I wanted that removable for that fact. I want you to be able to hide this, essentially.
I think that's an interesting perspective. The idea of it being red so that it's identifiable to everybody has its drawbacks.
I also wanted it to be able to sit in every environment. It's not just for sitting on, your closet at home. It's not just for shoving under your desk at work or having, somewhere in a workplace. It's also for having in your car. It's also for taking with you on vacation, having it in your RV.
Really security minded. Is there a reason why it's not a backpack?
So I really wanted a messenger bag style because I'm usually carrying a lot of gear, and oftentimes I already have a backpack on. However, I actually created this bag to be converted to a backpack. The backpack straps were mandatory for me, but I also wanted a pack that would stay discreet, so I wanted to be able to hide those.
You do have laser cut MOLLE webbing on the front, though.
I did that for a reason. I took the MOLLE webbing off and replaced it with this because it's much more discreet. So if you wanted to, you could attach your trauma to the outside, and now you've got the kits all in one place. I don't personally recommend that. This was a industry request to have the two that can go together. This is actually something that should have already been near me. So if I'm putting on, for example, a tourniquet, I have minutes or even seconds I don't have a whole bunch of time to go take this out, unzip it, go through all it, organize my space.
You know, I gotta say, and I gotta be honest, because when Jay sent me this kit, I was like, I don't know if they put a lot of thought into this, because, you know, it's not red, you know, it doesn't have all of the standard things at a first aid, and you've basically destroyed my worldview now, and I have to reconstruct everything from the ground up. It's good to know that there was a lot of thought that went into this, because I was a little bit concerned, to be brutally honest, but.
So we initially actually wanted one first aid kit. And I proposed, if we're gonna have one first aid kit, we want one that gives us the most bang for the buck. We want the first aid kit that is life-saving. In here, you don't really have life-saving equipment. You have first aid gear, but life-saving equipment is different. And life-saving equipment follows what we use in this industry, the March algorithm. Right. So beginning with, what will kill you the fastest? Massive hemorrhage. So this is actually Jase's version of the IFAK, or the individual first aid kit that you would find in the military. It's designed specifically for just dealing with injuries that are threatening your life. Once you're done with that, you might transition to what you find in this kit.
What about this guy?
So this is basically, for lack of a better term, it's a boo-boo kit. It's designed to manage small injuries, whereas this one's designed to manage lots of small to medium-sized injuries.
We've sold all kinds of kits here at Canadian Preparedness. What is different about this kit? Why is it unique?
I was asked by the founders of Jase Medical to create something that would expand on the Jase case. So we already know having medications is crucial in any type of scenario where there's low resource. So it could be an austere disaster, it could be, you know, a local crisis, it could just be you lost your job or your insurance. So having those medications is really important, but we don't just get sick, we also get hurt. And so I was asked to create something that could be set with the Jase case on the shelf, and it would include all the first aid supplies that we would use if we were to deploy into the mission.
Let's talk about the details of these after, but let's break into Big Bertha here.
When you arrive at the medic kit, you begin with essentially your diagnostic station. So I've included a pulse oximeter, a otoscope, so this is for checking ears and eyes. A toolbox, which has some of your dental tools.
Oh, right.
I wanted to include a variety of tools for things that people aren't thinking about. For example, let's say it's the weekend and you chipped a tooth and your dentist isn't working over the weekend. You take the included dental paste that's inside here and you use the little dental tools, the burnisher, and you cover that broken tooth until you can get to the dentist.
That's the first I've seen that in a medical kit, so.
And then a stethoscope. And I've been asked how come there is not a blood pressure cuff.
Oh, okay.
And the reason I didn't include a blood pressure cuff is because if I'm checking somebody's blood pressure, I'm trained to do that and I know what I'm looking for. Most of the time, somebody who's getting their blood pressure taken already has their own good quality blood pressure because they've had issues with blood pressure in the past. I left room to add it. So if somebody wants to have that, if they think they need it in their kit, there is space to actually put it. This panel also has our education cards. So we're building these out. It comes with these 5 initially, and then we're adding more as we make them. But here's your March algorithm that we just talked about. Here's how to clean a wound step by step using the tools that are in the kit. Here's how to treat a friction blister, the blisters you get from hiking, for example. All right, so there's your diagnostic tools. I designed this bag to be clamshell opening so that when I open the bag and I'm taking care of my patient, I create a workspace. This is basically my surgical table, right? I can do everything I need to do from just looking at what I have down here. Here are all my supplies. Having panels that are see-through was a big deal for me in designing it. This allows you to see all of the tools that you have right now, and if you need to restock because you use something, you can see that it's missing.
Can you just explain like the various sections of it for us?
So I put like with like. On the first panel, you should always be putting gloves on, right? Many of us forget, especially if we've been in the industry a long time, we get a little jaded. So I wanted the gloves to be front and center to help remind people that we need to take those precautions. Plus, the tools for doing your job are here on the front. So your hemostats, your irrigation syringe, scalpels, we've got some ear curettes for getting foreign bodies out of the ear. It's also a great place to store them because it's nice and flat.
Why a scalpel so front and center? Is that something you typically use right away? Or you might?
Not necessarily. I actually put them there because there's something that gets lost in the kits pretty easily.
And this is the salt, like a, or what is this?
These are just your hypodermic needles.
Oh,
so 18 gauge hypodermic needle. These do not fit on your syringe, which is an irrigation syringe. So I actually have been asked that, why do you have a hypodermic needle and you don't even have a syringe that it goes on? Well, the reason being is this is not for injecting anything into your body. This is for pulling things out. So the hypodermic needle, especially the 18 gauge, is probably one of the most useful tools we have from a improvised medicine standpoint.
What would I be pulling out with that?
Splinters especially, but foreign bodies in the skin. And if you've got a really big abscess that's fluctuant, you know, that you push it and it kind of has that little wave, this will drain it. You've probably done that with horses, and most of
I do it all the time, yeah. My horses.
And then the irrigation syringe is just for getting the appropriate pressure into a wound of irrigation. So we know from studies that wounds don't need to be soaked in iodine. You do have to clean them. So if you've got a wound that's very dirty, you might have to pick pieces out. But if you've got a really dirty wound, oftentimes just clean water or water with a little soap, squirt into the wound using a syringe like this is the exact right amount of pressure to flush out not just the foreign bodies, but bacteria that could be infecting the wound.
So that obviously is sterile.
No.
Not anymore, no.
But steril's not needed.
Okay.
Yeah, and even the package, this isn't a sterile packaging. It's a clean procedure to clean wounds. So as soon as you start cleaning the wound, by definition, you've lost sterility. But what do you need sterile for? So if I was doing surgery and it was a surgical field, then yeah, sterility is important. Even when I do sutures, like we were talking about earlier, if I'm suturing a wound, I want it clean, but I'm not looking for sterility because I'm not going to achieve that.
You're going to take antibiotics.
Probably going to take antibiotics anyway. Up here we have our bulk dressings and our Band-Aid packs. And our Band-Aids, we actually designed them specifically to have a high adhesion, plus they're flexible. So this is the fingertip Band-Aid.
And these are just gauze?
Just gauze wraps, yeah. So if you're applying gauze dressings, for example, and you need to wrap the wound, you can also use it to stuff in wounds if you're not ready to close it.
I presume you use a lot of gauze in an emergency.
You do, and that's why actually that's probably, of all of the components, that's the highest quantity.
Right.
Because these tend to run out. But
Yeah.
you'll probably blow through all that and need to replace it. So this was designed to be restocked.
And this thing comes off if need be.
Yeah, so I could actually take this and hand this to somebody and say, hey, bandage that wound.
Yeah.
Here's the two modules for bandaging. While you can use these also as bandages, you could actually use this as a dressing, and then you could use the Curlix, which is also, we call it vet wrap. Back to the horses.
I don't know why you think I have horses. I know I look like I scream horse guy, but equestrian over
I
here.
flew into Saskatoon and there's like farmland, 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 farmland city.
Yeah. It's a stereotype up here. Just wheat and horses.
And then here's your 4x4 dressings. So this would be like your non-stick dressings.
What is this device here?
Eye shield. If you have an injury to the eye,
Yeah.
you can put the eye shield on and take somebody to...
Looking like, what's his name? Aspinall. And a lot of this stuff looks like it's, you know, your own stuff that you've created. Like, what is that thing there?
We didn't actually create this. We put our name on it just because we needed a place to put Jace. You know, it's just an aluminum moldable padded dressing. So you can use it on fingers. You could actually make an eye shield out of it. So lots of little uses for that. And I included a bigger one inside the kit as well. We've also got medic shears.
Is there a suture kit in here?
No, this kit doesn't have a suture kit. However, if that's something you know how to do, there is space to put it. So one of the things I included was a way to take care of, or to close a wound without having to put a needle through the skin around it.
Yeah.
So your mastisol is your adhesive.
So that's like your super glue.
Exactly. This is your super glue basically, but it's also can apply to these wound closure strips, also known as steri strips.
And that'll stay shut long enough that you don't need stitches, or
Yeah, I'll give you one example. When a woman has a cesarean, she doesn't get sutures. She gets taped shut with exactly this. So if it will hold guts in after cutting a baby out, then it should be able to hold a 3-inch laceration on a arm.
How do you feel about skin staplers, just as an...
Staplers are great. Yeah. They hurt just like sutures though. So yeah, it works fast. And I use staplers on the head. So anytime I have scalp lacerations, because staplers don't look like hair, but sutures do, and they just close better. So any head wounds, and I'll just staple it. But there is another option. This is called a zip strip. So this is super adhesive, and these work incredibly well.
So this is like combines an adhesive with like a zip tie kind of concept.
Zip tie, exactly. Yep. Right. It's basically 4 zip ties opposite each other. You just zip them together till the wound is approximated where it's supposed to be, which is just with the edges just barely coming together like that. These are designed, and the ones that we got specifically have an adhesive that's pretty strong. And then flipping to the other side, it's cleaning supplies. So more burn care. You can manage actually a pretty substantial burn or burns with this kit. The burn dressings aren't necessary. They're not a requirement for taking care of burns. You can manage burns without them. So let's say you burn through all of this stuff. Did you get that?
Good one.
So if you do end up running out, you still can continue taking care of burns. I even have a sterile burn sheet that doubles as a triangular bandage in here. It's quite large. So that is sterile. And you want sterility on burns, because burns are notorious for getting infected. They're also notorious for being sources of dehydration because they weep. So if you have extensive burns, getting them covered and keeping the patient warm and hydrated is ultra important if you're in an austere setting.
And this is just like sterilizing agents?
So your iodine prep pad, your alcohol prep pads. It's kind of like this is your skin module. So there's some stingies. So if you get an injury from like a ocean fish or a wasp or something like that.
You got some mosquito repellent there as well?
And I got a little pushback on this at first. They're like, why do you want to put mosquito repellent? That's something that people should just have. Well, they should, but if you're putting stingies on because you got bit, then that means you forgot your mosquito repellent. And so what I found is having, like for me, I've got like a packet of mosquito repellent or one of those the repellent spritzer, I've got those almost everywhere.
If you have a patient that's like getting eaten and they're moving around and flailing, like you gotta settle them down first.
They're not thinking about their own care. Yep, exactly. Or yourself, if you forgot it, now you've got a backup. And there's also some other topical supplies in this kit. You've got some hydrocortisone cream. You've got antibiotic cream.
Is that the prescribed hydrocortisone, like 2%
no,
or whatever?
1%. That is actually on my list of things that I want to have in this kit at some point.
You can get it when you order the Jace kit. It's as an add-on.
Yeah, so. If it's something you actually need, like say you've got psoriasis or you've got an autoimmune disorder, that is something I would definitely keep in my Jace case.
Just so people know, this is where we would have our antibiotics. It would be in here, as well as other medications, which will come with this kit, correct?
Yeah, and it was designed actually to store them right here in the kit so that you always know where they are, and they're with all of your other first aid supplies. So this is kind of your doctor bag, right, at home. So the emergency blanket, this actually was also a project. I looked high and low for a Mylar that wouldn't rip. So this is the extra thick Mylar. This you could actually literally wrap around yourself, roll around in the dirt and rocks.
Is there a few in there?
No, there's just one. It's the extra large. It will actually cover all of you or all of.
Yeah, that is a problem with this stuff.
Huge problem. That's why I've always hated Mylar blankets, but people don't realize that there's a difference. And then of course the ever ubiquitous, because all of my cases have this, is duct tape. Everything I carry has duct tape. Yeah.
That's cool.
And I use that for blisters, I use it for wounds. I have a module in my course that I teach how to make steri strips out of it. Super useful tool. This is the Slishman wrap. I said Sam because Sam is his first name, Sam Slishman, good buddy of mine. And I include this because this is seriously probably one of the most useful tools. So it's super strong. It was created sort of on the same philosophy as you mentioned the Israeli bandage or even just an ACE wrap.
Yeah, it's got like multiple strands.
Which if you cut one strand, it won't tear through the others. So you can actually damage it quite a bit. And each of these little tabs gives it a stopping point. So if you use this as a wrap like an Israeli, like say you got a wound in your arm and I just put a bunch of gauze in it to compress it, right?
Yeah.
I could just use this as the pressure.
So it's kind of like a tourniquet?
Well, so that's what's so cool about it is I could put this on as a compression wrap, but I've also make a windlass improvised tourniquet out of it, and it will hold itself on. So you probably feel you're
definitely working. Yeah.
But because it's elastic, it's maintaining constant pressure.
The scissors in conjunction with
Yeah, it could be anything long. You can use a
anything long and
hemostat.
straight.
The reason the scissors, you need to have a way to hold it, right? So having something that's irregularly shaped.
And so that loop, can we just maybe, that's really sticking on there, hey? So you could
Like let's say you don't
your
have,
arm
yeah,
through
let's
there.
say you don't have a tourniquet and you're like, oh crap, I gotta stop this bleed. Maybe it's down here, we put pressure on it.
Yeah.
You could slide this up the arm and actually go through the same process you would in applying a tourniquet. And I love this because in my experience, except for in the military, the tourniquets I've seen used the most were improvised.
So you do kind of get a tourniquet in this kit.
Yeah, it is kind of, I mean, it's what we would have done with an ACE wrap if we didn't have anything else. It's also like the Israeli bandage or the military compression bandage.
Now, is there a how-to video on how to use some of this stuff for people? Is that something you guys are working on?
Dr. Slishman actually has his own YouTube channel, and he posts a lot of stuff on different ways to use the Slishman wrap. I included the nose clip if you've got a nosebleed, because they're really a bummer to deal with when you've got somebody who really has a nose that's bleeding and it won't stop.
Yeah.
So that's it for the medic bag.
This is called the trauma kit. Can you tell us a little bit about this?
So the trauma is your life-threatening injury kit. And I designed this one in such a way, again, so that it could be discreet. It has a similar look, but it sort of disappears in the background. If you were to take this off, you won't really pay attention to that if it's just sitting somewhere, right? However, when you need it, open it up. The first thing that you're gonna see are the tools that you need to use in the situation. So the trauma was designed for life-threatening emergencies. We already talked about the MARCH algorithm. So MARCH begins with stopping massive bleeding. Now, when we sell them and ship them, they have to ship in the plastic. That's kind of a requirement, but I remove all the packaging off of all of my gear. So
you need it in a pinch. You want to get that out of there.
I want to challenge you actually right now to open that and put it on my arm, for example. No, you can't use your knife. Everybody thinks, well, my knife is always going to be there, but there's one time you just got off the plane coming to visit. Yeah. All right, pause. You had to use your teeth, first of all,
Right.
which can be dangerous, and I come from a family of dentists, so I don't cringe, but they do when I see somebody using their teeth like that. It takes extra time, plus you just grabbed this after you were trying to stop the bleeding on my arm. So what's on your hands? Most likely blood, right?
Yeah.
So holding on to that and getting that plastic off while it's slippery and covered in blood, and now you got my blood in your mouth because you just used your teeth.
Yeah.
See the problem? Now, I designed this kit so that you don't even have to keep the tourniquet inside the straps. Even though there are plenty of straps here, you can actually configure this how you want. And I designed these straps to be able to do that. But if you use the snake staff like we do, you don't have to put it in the strap.
Just pull it right off of there. That's perfect.
And I prefer the snake staff systems. It's
Sorry, what is that called? The
This is
snake?
the Snake Staff Systems ETQ, but all it is a different brand for the cat tourniquet, yeah, or the Soft T or the SWAT, or there's a bunch of different tourniquets on the market. And this one is a windlass tourniquet. It has a clip for securing the windlass after you've tightened it appropriately. So it follows.
Do you want to demonstrate that real quick?
We can, yeah. I'm going to put the tourniquet on the limb, and I put it on so that when I pull the strap, it's pulling towards me so that I can get the maximum amount of pressure from the initial pull. All the windlass is doing is now complementing all the pressure that I already started. Feel how tight that is?
It's tight, yeah.
So it only takes one or two before the bleeding may have already stopped at that point. You're already feeling that pressure, but for me to get to that maximum tension. When people apply tourniquets, they usually miss that step. They put them on and then they start twisting and twisting and twisting, and pretty soon you run out of twistability. Yeah. Because these aren't designed to keep twisting very far. You only have, in this particular one, you only have a few inches. Following the March algorithm, if you have an airway issue, meaning a hole anywhere in the box, so that's where the lungs are.
Yep.
If it's a sucking chest wound, you're going to want to seal it. You're going to look for any exit wounds. If there's a second wound, then you would seal that one too. So this kit comes with 2 chest seals. We use vented chest seals for both of them because you never know which one is going to be sucking. Chest seals need to be monitored. So if somebody's applying the chest seal and they don't know anything about chest seals, you could cause what's called a tension pneumothorax, which is where you've now built up so much pressure in an enclosed space that their lungs are getting pushed out of the way by air outside of the lungs but still inside the cavity. So the chest seal in a case like that would need to be vented, or what we call burping, where you would lift an edge and let the air escape. The vented just gives you one less thing to worry about. Here's your Israeli bandage, as we talked about before.
This one is sterile.
When you put this on, is the wound that you're treating sterile? No. By definition, you're in the field, it's a field intervention. So you're putting a compression bandage because this is happening fast right in front of you, right? You just exposed that wound. Maybe it's a stabbing or a gunshot wound. You didn't take that person into a surgical bay and do a washout. There's nothing sterile about anything in the environment, right? So applying a dressing that is non-sterile but clean is just as appropriate.
You want to minimize, but you're not going to eradicate everything. Yeah.
And then our other dressings for wound packing, for example, we have our hemostatic gauze.
Right. Clotting agent.
It has a clotting agent in it. We're using the one that has kaolin, but there's other varieties. And you also want to pay attention when you get these and where you get them from. How long is it? Did you actually get 4 yards of gauze, or is it like 2.5? You want as much of this, so you make a little ball and you shove that whole thing right up next to that artery that's bleeding, because you want as much surface area to give that thing the best chance of clotting.
Right.
Whereas with like just compressed gauze, I'm just packing as much of it in there as I can to get it to stop, and then I want to maintain that same pressure inside the wound as I either pack more or bandage it.
Okay.
So to me, it's useless to have any less than the 4 yards that are more typical. This is a nasopharyngeal airway. So this is to slide down one of your nares to keep your airway open.
Huh. Yeah, you don't see that too often in some of the kits that we sell.
Yeah, and like I said, I wanted this to be purposeful, but have everything that you would need. So if you have the skills to go beyond just basic trauma care, equipment is there for you. Over here, we continue with the March algorithm. So airway respirations, and then we get to hypothermia. So what kills people in a traumatic setting, especially with massive hemorrhage or with lots of blood loss, is hypothermia, because it affects the clotting cascade, or what actually makes the blood stop bleeding, so forming scabs. When you get cold, you don't form scabs very well. So by keeping the patient warm, your blood will form that scab easier. The problem is when you lose blood, you lose heat, because the blood is carrying all that heat, right? So being able to keep the patient warm is crucial and emphasized heavily. That's why it's in the March algorithm. So what we've done is added, again, that same blanket. It's extra large and it's thicker, so it's not gonna rip. And with this, after you've managed the patient, you would wrap them in it and anything else you can find to keep them warm in what we call a hypothermia burrito. We also have some burn dressing and abdominal pad, which is just a big cotton dressing, and then our eye shield. So this kit was designed around a kit that contains your basic trauma medications like we would use in the military. And it contains an antibiotic, which is, in this case, moxifloxacin. You got meloxicam, Movic, which is an NSAID.
What's an NSAID?
Non-steroidal anti-inflammatory, so it's your ibuprofen.
Is it like a stronger one?
Yeah,
or
it's long-acting, so it's a 24-hour version of like your ibuprofen.
Okay.
You're just taking it once with your meloxicam.
Right.
That buys you 8 hours of pain control, plus your meloxicam, which is,
And
that gives you 24 hours of pain control.
So when you say pain control, what are we talking about in terms of pain control?
It's like taking ibuprofen and Tylenol. I mean, you're still gonna have pain, but is the pain sufficient that you can still perform your functions? Maybe.
It's not debilitating.
Maybe, but every case is different, right? It's going to be very situational and circumstantial.
What's the fourth medication?
Zofran, ondansetron. Ondansetron is an antiemetic. It's an anti-nausea. So sometimes, often actually, when people get injured traumatically, they develop nausea. Well, in addition to hypothermia, we talked about dehydration is also another component of reducing patients' ability to survive.
That kit is pretty cool because usually you see these kits, they don't have that in it.
Never. This is the first time it's been offered.
So it really is built around this.
Yeah. I'm aware of no other company that's providing that to civilians. And that specifically was my first caveat, was if we are going to make a trauma kit for pharmaceuticals, what I use in the military is what I want in this kit.
What's really innovative here is not only your kind of gray man design, but also the fact that it's built around prescription medications that you're getting from a medical professional. This is not a scam. You know, we've had a relationship with Jace for a few years, so I think people are familiar with the process, most of our viewers, but if you aren't, you basically go online, you fill in some information, super easy to use, user friendly. I did it today and it's just like, you know, a child could do it. You check all the boxes, doc calls you up if there's a problem. Super easy to do and could make a world of difference, because like you're saying, it's one thing to have all this flashy medical gear, but nobody thinks about if you're in agonizing pain, you know, you're not going to be able to function, right? So maybe you stop the bleeding, but you know, what do you do after that if there's an emergency and no help is coming for 24 hours?
Yeah, exactly. We're facing times where resources are depleted. Our EMS systems are running at their maximum. Police and EMS are taking longer to get to scenes. We have governments that are less able to take care of their people and admitting that if we were to have any kind of catastrophe, especially a black swan event, it could be disastrous because all of those resources that supposedly are cached and waiting for that event, they're not actually there. The whole point behind Jace is to eliminate these barriers of having regular people have access to life-saving critical resources. The medications are the critical resources that when we have an event of any kind that disrupts normal life, those are the first things to go.
You know, antibiotics are worth more than gold. They're worth more than food even in some cases. So these types of medications are life-saving, and would strongly recommend you get 1 or 2 or 3. Honestly, you can't have enough. Well, man, I want to thank you for coming out and showing us this stuff. If you guys want this, get it through the link in the description below. I think these, are they available in Canada yet, or?
I mean, they're working overtime to try and figure out how to make these available in Canada right now, because Canada is a very important market to Jace.
Yeah, I think we can get the kits, but maybe not the medication, or there's some kind of sticking point. But you can get the Jace antibiotic case. You can get a lot of stuff in Canada. But if you want the kits, you might be able to get the kits by the time this video is released. We don't know, but in the States, for my 65% of viewers are from the US, obviously you can get this stuff. Aaron, thanks for coming out. Appreciate it.
Thank you. Thanks for having me.
No problem. Anytime.
The best way to support this channel is to support yourself by gearing up at CanadianPreparedness.com, where you'll find high-quality survival gear at the best prices, no junk, and no gimmicks. Use discount code PREPPINGGEAR for 10% off. Don't forget, the strong survive, but the prepared thrive. Stay safe.